And perfect. Thank you. Good evening, everyone, and thank you again for joining us tonight for your Community Engagement Live webinar. We are covering regions 56, which is Will County, and also region 1-B-C, which is Southern Cook County. So if those are the regions you were interested in, you are in the right place. My name is Sonia Clark. I am the Director of Operations here at Birth to Five, Illinois. And so again, just want to welcome you all and thank you for taking time out to join tonight's webinar. Just a couple of housekeeping items that we will get out the way before we jump into our presentation tonight. So as you can see, we are recording tonight's event, and we do post and share these recordings that we do. We have recorded every single one that we have done this month. And so we do share these on our Birth to Five YouTube channel. And it will be posted there following tonight's event. So for anyone that was unable to attend, if you have colleagues that maybe intended to participate but weren't, you can direct them to that. Or if there's something that you miss out on, because maybe you're multitasking tonight with your family, and so you may miss a piece, so you can always refer back to that recording that is posted on our YouTube channel. We are offering live Spanish interpretation this evening, so I will pause for a second so that Gabriela can give you a message of how to participate in Spanish.
Thank you. Hello, everyone. I'm going to switch to Spanish very quickly. Welcome. Muy buenas tardes, ¿cómo están? Bienvenidos y bienvenidas. Soy Gabriela, la intérprete de español, y me gustaría muy brevemente mostrarles cómo pueden ustedes entrar a la línea de español o al canal de español, si así lo prefieren. Si usted está usando una computadora, por favor vaya a la parte de abajo o inferior de su pantalla. Va a haber un globo del mundo que dice interpretación. Por favor, dele clic a ese globo y escoja Spanish o español. Si usted está usando un teléfono, un iPad o una tableta, toque su pantalla, seleccione los 3 puntos que aparecen en la parte derecha inferior de su pantalla. Una vez que usted haga eso, se va a abrir un menú. Entre ellos va a haber la opción de lenguaje, interpretación o interpretación de idiomas. Seleccione allí. Una vez que seleccione allí, seleccione su idioma de preferencia, español en este caso. Y por último, seleccione la palabra D de dedo o NE, que es done en inglés, listo o finalizar. Una vez que usted seleccione allí, inmediatamente se va a dar cuenta que regresa a la pantalla principal y la palabra Spanish o español aparece en su pantalla en la parte de arriba a la izquierda. Déjenos saber si necesita asistencia. Muchísimas gracias. Thank you, everyone.
Thank you, Gabriela. And so we are also, there is closed captioning that is also available, and there's a CC button that will be at the bottom of your screen if you're interested in that too. Just a heads up, the closed captioning is being provided by Zoom, and so we have no control over the closed captioning, and sometimes Zoom has some errors in their closed captioning, so we apologize in advance for any errors that may occur if you are utilizing that closed captioning function, but just want to make folks aware that sometimes there are errors there that we have no control over. Also, initially, I think we were planning to do more of a town hall type of format, and we decided to go with a live webinar because we felt like that would ensure the highest quality experience for all attendees, making sure that we could meet all of our goals that we have in our presentation tonight, and also to make sure that we have ample time to be able to answer questions as they come up during the presentation. So any questions that you may have, we want to have time to be able to address those questions. So speaking of our goals, some of our goals for tonight are to introduce our team so that you have a better understanding of roles and responsibilities here at Birth to Five and everyone who's kind of working to stand up these councils and to do this work. Also to share more about the work of Birth to Five Action and the family councils and what that will look like. And again, to answer any questions that you may have. And so some of you may have participated in our kickoffs that we did in early February. And some of you may not have been able to participate in those. So some of the information that we will share tonight will be familiar to some of you if you've been following us, or if you've been if you participated in our kickoffs that happened in February. But most of the information tonight is new information. So for everyone that's attending, whether you attended February or not, but also making sure that we capture some of what we did in February to bring those up to speed that were not able to participate or have not been as closely following our work here at Birth to 5 Illinois. So the chat is open, and as you may have noticed already, we will be using that chat function to drop links as we're going through the presentation to interest forms and other information. We will use that chat function for that purpose. You can use that chat function as well if you have any comments that you'd like to make to the team. So you can feel free to use that chat function as well for any comments that you want to make during the presentation. But if you have any questions that you would like to address to our team and you would like to have us to answer during the presentation when we get to that point in our presentation, please use the Q&A box. There's a button for Q&A that's located at the bottom of your screen. So for any questions that you would like our team to address, please use that Q&A box at the bottom of your screen to submit those questions at any time during the presentation. We are taking questions and then we will answer them when we get to that place in our presentation. So we will be answering questions first that were submitted to us via the registration form. So if you registered for tonight's event, there was an opportunity to submit any questions that you may have had at that time. And so we have collected those questions that were submitted to us at registration. So we will first address those questions and make sure that we answer those questions. And then secondly, we will go to that Q&A box and we will answer questions that folks have put in throughout the presentation in that Q&A box. So you can feel free at any time during the presentation to put your questions into that Q&A box. You don't have to wait until the end of the presentation to do that. We will be taking those questions, but we will be answering them at that point in our presentation tonight. As you may have noticed, everyone here is muted right now. And so there will be a point, so after we do all of those questions, the ones that came in from registration and the ones that came into the Q&A box, time permitting, we will allow live questions. At the end of our presentation, there is a raise hand function at the bottom of your screen. So once this initial presentation is over and we answer those questions, then we will go to live questions. So you can raise your hand, someone will acknowledge you and then take you off of mute, and then you can answer your question. You can ask your question at that time for us to answer. And then finally, some have asked a question about whether or not we will be giving any certificates for attendance for tonight's presentation. And unfortunately, we will not be giving any certificates of attendance for tonight's webinar. So I think that takes care of all of the housekeeping items that we needed to address before we got started. So we can jump right into the presentation now. And we will start with kind of level setting and helping folks to understand what our mission, vision, and our values are. So starting with our vision, which is reimagining a more equitable early childhood education and care system that ensures family and community voice is centered and prioritized at every level of decision-making in Illinois. And so within this vision, you will notice some very key terms that we have highlighted because we are amplifying those. We are leading this work with equity and making sure that family and community voice are prioritized. So moving away from that top-down approach to leadership and more of a bottom-up approach to leadership, where communities and families and providers are really guiding this work and in the driver's seat of this work to inform policy and decision-making within the state of Illinois. Next slide, please. which leads me to our mission, which is to create a statewide regional infrastructure that will amplify input from communities in the development of policies and funding priorities. We mobilize communities to build and sustain equitable access to inclusive, high-quality early learning childhood services for all children and families in the state of Illinois. So one of the things we really like to point out as far as our mission, we're building this regional infrastructure to be able to amplify and gather the input from communities, but also to be able to give that information and inform the state when they're making decisions and such, but also to mobilize communities to come together, identify those issues, barriers, challenges, and needs within the region, and to kind of mobilize together as a region to try to start to problem solve those issues and challenges and needs that you have, and begin to talk about how you can address it, and getting buy-in both figuratively and literally from all of the stakeholders within the community to start to address and mobilize around addressing issues and challenges and the needs within your own communities. Next slide, please. Which brings us to our values and our goals. You will hear us mention multiple times tonight, we will talk about family voice. And that is because it is we are so committed to that, and it's so important to us to make sure that we are centering family voice and really getting to that authentic family and community engagement that we're looking for to help us figure out how we address the inequitable distribution of resources and services and begin to rebuild our state's early childhood education and care system. So that is very important to us. We are very committed to that and making sure that we have family voice that is centered and prioritized in this work, and they are informing this process. Then goes to racial equity. Racial equity, unfortunately, we know that race is oftentimes a predictor of a child's success. And so we are trying to move to a place where race is no longer a predictor of a child's success. And we want to start to address those barriers that have limited access to all of those high quality services, particularly for minoritized children in every corner of our state. So beginning to address that, with race equity and trying to tear down those barriers that have been in place that have limited that access to those high quality services that we know from all of the research is a predictor of success in the future for our children. Also goes to collective impact. And so we are trying to build a system that really harnesses that knowledge that comes directly from families and providers and the community. And again, like I said earlier, mobilizing those decision makers to make sure that we have those new or expanded services that are needed within the communities, and that they reflect the needs that the community has told us are needed, right? And so we want to make sure that the needs that are being expressed, that decision makers have that information, and that they are providing those resources that are needed in the communities that the communities themselves have identified and said that they need. So we want to make sure that we're influencing policy and funding at all levels. So that includes the local, the regional, and the state levels. Next slide. Which brings me to our fabulous team, small but mighty, here at Birth 5 Illinois. So we have Cicely Fleming, who is our state director. Again, my name is Sonia Clark. I'm the director of operations. We have Dina Chapman, who is our family and community engagement manager. We have David Quiros, who is our family and community engagement coordinator. We have Angela Hubbard, who is our grants and relationships manager. Maggie Kohler, who is our communications manager, and Jess Scheinflug, who is our project coordinator. And so I just want to point out that who is joining us tonight from our team. We have Maggie Kohler and Dina Chapman, who are joining us from our team. Now, originally, we have had these webinars going, so at every other webinar except for this one, because this is the last one that we're doing. We are wrapping up. I think there were 17 of them. So we were doing them every Tuesday, Thursday nights, and we had kind of split our team in half, and half were doing a region, and then we were doing another session with some other regions. Well, the other half of our team is not here. They have the night off, and we are pulling a night shift and getting this last and final one done with the team that I have identified that is here with you tonight. Next slide. And then we have our magnificent area coordinators, who we could not do this work without. Our area coordinators have really been our boots on the ground to get the awareness out across the state, to do outreach, to help us build our contacts and our database with just those folks that we want to have interested and engaged in this process. And so we have 6 of those area coordinators. For area 1 is Corrine Nunnally, and Corrine Nunnally is joining us tonight, and she is your area coordinator for both regions, area 56 and for 1BC. So she is here tonight. She is available if you have any questions that come up after tonight. She has been doing presentations to some small groups that have requested it. So she has a wealth of knowledge, and she is available to you for any additional questions or any other supports you feel like you may need. We also have Diana Murdian, who covers Area 2, Jackie Jones, who covers Area 3, Dana David, who covers Area 4, Kim Hunt, who covers Area 5, and Lori Longville, who covers Area 6. Next slide. So what is Birth to 5? So in partnership with the state of Illinois and the Illinois Network of Child Care Resource and Referral Agencies, better known to folks as INCRA, we have launched Birth to 5, who has really been tasked with creating both the Birth to 5 action councils and the family councils in each of the 39 regions in Illinois. And so that is a heavy lift. We've got our map there to kind of show the geography of the regions, those 39 regions in the state. So some may be one county, some may be multiple counties that make up a particular region. It is important to note that we are working with Every Child Ready Chicago. So for those of you, because you are very close proximity to Chicago, you may have been wondering what's happening with Chicago because we had not done a kickoff for Chicago yet, but we are working with Every Child Ready Chicago to host their virtual kickoff for the city, which will be held tomorrow. And so if you are interested in the city of Chicago and the kickoff for the city of Chicago and Every Child Ready Chicago, you can feel free to register for that. They will be holding 2 sessions tomorrow. The first one at noon, and the second one, I believe, is at 5:30 in the evening. I think I got that right. All right, and so to make sure that we're maximizing impact and collaboration, Every Child Ready Chicago will expand their membership to serve as the Birth to 5 Action Council for the city of Chicago. So interest forms for Chicago, which is Area 1A, will open up after tomorrow. So after their kickoff, their interest forms will open up to expand their membership in Chicago. The councils, like I said, you can see on the map there the geography of the councils. This map may look familiar to some of you. It is the Illinois State Board of Education's Regional Offices of Education map. So we share the geography with the ROEs, but we do operate independently. It was just easier to share that geography and clearly define regions. And so we utilize their geography when it comes to the councils themselves and the regions themselves. There are several important goals for the work of Birth to 5 Illinois, and one is to support local residents in coming together. to begin to address early childhood needs within their own communities, or to build upon that work that has already been going on within communities to address the early childhood needs. Secondly, to make sure that the state's policies and funding priorities match the needs of each area and each region. So again, making sure that we are prioritizing those voices of families and the providers within that community, to make sure that they are matching those funding priorities that come from the state, are matching the actual needs within each of those regions. And then we want to make sure that we are providing access and equitable access to the highest quality early childhood services for all children. And so those are pretty much our goals and our primary goals for this work that are guiding and driving us into what we're doing at Birth to 5 Illinois. We welcome folks with a range of experience, including those that may be new to this type of work. We understand that we have not historically had the perspective of everyone, right? Everyone has not had an opportunity to lend their voice to these type of initiatives. And so this is an opportunity. We want to make sure that we're reaching everyone's, particularly those that may not have had an opportunity to lend their voice in this way, or had a seat at the table in this way. And so we are particularly looking for new voices, new perspectives, and looking to diversify in our understanding of experiences within each region. We are in the process of hiring, so dedicated staff in each region. We are in the process of hiring a regional action council manager in each of those 39 regions. In each of the 38 regions, it is the 39, because the one for the city of Chicago went up last Friday on April 1st. So that position is now posted as well. So all 39 positions for the Regional Action Council Manager are posted and available, and we have started the screening and hiring and interviewing process for that. So if you are interested in that, Maggie is going to drop that link in the chat. She probably already has done that. And the managers are really basically going to oversee the formation of the councils and the ongoing operations of the councils, including hiring additional staff that are allocated for each one of their regions, which includes a family and community engagement staff and also an admin / data staff. So there are 3 dedicated staff in each one of the region. That is the investment that the state has put into this to ensure that we can get this work done, and that we're looking at equity and staffing is not an issue, and that we're not putting more work on the backs of those that have already been doing this work within the communities. Next slide. All right, so, okay, now I will hand it off to my colleague, the dynamic Dina Chapman, who is going to talk to you about serving on your Birth to 5 Action Councils. Dina?
Thank you, Sonia. Good evening, friends. This is Dina Chapman. I'm the Family and Community Engagement Manager for Birth to 5 Illinois. And tonight, I am tasked with sharing with you more information about both the Birth to 5 Action Council and the Birth to 5 Family Council. So we will begin our discussion about the Birth to 5 Action Council. The Birth to 5 Action Council is charged with being a leadership team that will provide vision and direction for the Illinois early childhood landscape. We are looking to seat 15 people on our Birth to 5 Action Councils, 15 per region. We are looking for a variety of different experiences and skills. So this first slide is a comprehensive list of what we're looking for and more. So this list is not limiting, but it is comprehensive. So I'll just take a moment to read aloud to you some of the experiences and skills that we're looking forward to having on those action councils. We're looking for parents and family members, community members from underrepresented populations, local early childhood or education collaboration members, Head Start or Child Care Center staff, family child care staff, early educators, home visitors, early intervention providers, staff from the ROE, the Regional Office of Education. We're looking for local school district like board members and superintendent staff and teachers. We're looking for local or county elected officials and healthcare employees, higher education employees, coordinated intake staff and staff from the CCR&R, Child Care Resource and Referral teams, business representatives like from the Chamber of Commerce, members of the faith community, and anyone else that is not listed on this slide. You are welcome to join the Action Council. Next slide, please. So what exactly will these Action Councils be doing? Well, we are looking for the Action Councils to identify gaps in early childhood needs and make recommendations to expand services, to help to amplify that family voice that Sonia talked about earlier, lifting up authentic parent engagement. You will be working with local coalitions and communicate within the community. We will look for the Action Councils to collaborate with the state team and to work closely with the Birth to 5 Illinois state team, Action Council staff, the Early Childhood Transformation team, and other partners in the region. Conduct a regional scan, otherwise known as a needs assessment. And then to also create an annual report that makes recommendations to expand or create services in the region. Next slide, please. So maybe you're wondering, what are the requirements and commitments of Action Council members? Well, you must live, work, or receive early childhood services in the region. Understand that this is a volunteer leadership role, and the expectation is that there will be approximately 2 meetings per month that you'll be expected to attend. This is a 1 to 2 year commitment. So everyone on the Action Council will have to make the commitment for a year and have the option of recommitting to year 2. Of those 15 seats on the Action Council, 2 seats will be allocated for family members, and those family members will receive a stipend for their time. Next slide, please. So now I'm going to talk a little bit about the Birth to 5 family councils. We understand that true transformation can only happen with authentic parent engagement, which will happen through the Birth to 5 family councils. So on the family council, we're looking for families with children under the age of 8 and or experience with early childhood education and care services are eligible. If you've not had any experiences in the Illinois early childhood education landscape, that's perfectly fine. Like the Action Council, we are looking to seat around 15 members per family council per region. Next slide, please. So as part of the Birth to 5 Family Council, parents and family members will have the chance to make a big difference for children and families in their community. And here is a list of what the family councils are tasked to do. The Family Council will serve as an advisory committee to the Action Council. So they will be working in tandem with those Action Councils to share critical input and give feedback. They will advocate for family needs. Like the Action Council, they will be identifying gaps in the regions for the services that are needed. And they will be asked to raise issues of concern from within the community. We have a Birth to 5 Family Council flyer that's being dropped in the chat. We are working really hard to do outreach in all of the regions to seat the Family Council. So if you could help us in that effort, that would be phenomenal. You can post the flyers on your social media platforms. You can distribute the flyers amongst your parent organizations and ask them to distribute them within their parent networks. When I say we, I'm saying myself and my partner, David Quiros, who's the Family and Community Engagement coordinator. We will go where we are invited. So if you'd like to have us come out and speak to your parent organization or parent group, we're able to do that as well. Next slide, please. And here are the requirements and commitments for the family council members. So we are looking for a diverse family representation. Understand that this is a paid leadership role. So parents and caregivers on the family council will receive a small stipend for your participation. You will be expected to participate in meetings approximately twice a month. And like the Action Council, you'll be asked to do a 1 to 2 year commitment. Everyone will commit for year 1, and then you'll have the opportunity to re-up for year 2 if you so desire. Next slide, please. So if you feel like the Action Council or the Family Council is not your cup of tea, but you still want to help to lift the work of Birth to 5, we have something very special for you, and that is our selection committee. So the selection committee will help to seat the action councils and the family councils. This opportunity is a volunteer opportunity for local residents. You must live, work, or receive services in the region. You cannot be a member of the Action Council, the Family Council, or be on staff for Birth to 5 Illinois. And your commitment would be approximately 2 to 3 weeks to help score those interest forms once they close. So the chat box is probably jumping right now because Maggie is dropping in links to the selection committee, the action council, I'm sorry, and the family council. And next slide, please. Okay, so my part for the moment is over, and I want to pass the next piece over to my teammate, the very charismatic Karine.
Thank you so much, Dina. I greatly appreciate that. And good evening to all of you. Again, my name is Karine Nunnally. I am the Area 1 Coordinator, which includes Cook South and Will County. So Birth to 5 Action Family Councils, in terms of partnering, right, with community collaborations, are looking to partner with these collaborations throughout the state. We are here to both help build capacity where possible and to share information regarding the future planning. So action councils and family councils, as Dina has described them, are not here to replace or duplicate the work of the local community collaborations. Ultimately, our goal is to make the community work easier if and when new governance and funding models for the early childhood education and care is designed statewide. One that's actually going to be based on the needs of young children and their families. So for those organizations that are already doing the work on the regional level, our leadership team has engaged in conversations about how to align those efforts. And in those areas where there's more localized efforts, once hired, the regional staff are going to be taking a look at how to build on the work of those collaborations by ensuring that the gaps, the barriers, and expansion needs that they've already identified are highlighted in the regional scan that the action councils will be being involved in. So in addition to this work, there are going to be new efforts in engaging families and providers that have been historically left out. So it is definitely our hope that Birth to 5 Illinois is seen as a part of the community system and an additional early education advocate. Finally, we have a wonderful funding opportunity that we're looking at being launched in the spring sometime to help collaborations regain and increase enrollment in early childhood programs, especially those programs that saw decreases in enrollment due to the pandemic. So more information about that is going to be shared as it becomes available. If you could go to the next slide. So next steps and how to get involved. Both the Birth to 5 Action and Family Councils will be community driven. Birth to 5 Illinois is providing the infrastructure and the support to ensure that there is equitable representation on both councils created within each of the 39 regions. So we are ready to stand up these councils as soon as the community is ready. And now what we need is you and others in your community to complete an interest form, if you haven't already, so that we can see where the interest is and where we need to increase our outreach efforts. You complete an interest form for your region's Birth to 5 Action Council, for the Family Council, or for the Selection Committee. And the Action Council and Family Council interest forms are available in English, in Spanish, and Polish on our website, as well as the Selection Committee interest forms. So please continue to visit our website. The information is available in English, Spanish, and Polish to learn more about the work and how you can get involved. And we also want to encourage everyone to visit our frequently asked questions pages, which was updated with the answers to the numerous questions submitted to our team during our virtual kickoff, as well as updates from the past webinars, the live webinars that have taken place. And Maggie has done a great job adding all of those links in the chat as well. Finally, additionally, we want to encourage you to please apply for one of the positions, or if you know someone who might be interested, to please apply. Again, as Sonia mentioned, we are currently hiring 39 Regional Action Council managers, one in every region across the state. You can subscribe to Birth to 5 email communications to stay in the loop, as well as connect with us on social media. And Maggie, again, is putting the links to our social platforms in the chat, and they can also be found at the bottom of our website and at the bottom of all of our email communication. And so we are going to move to the next slide, which means we're going to conclude our presentation for the evening. And now we're going to transition into our Q&A portion for tonight's event. And we will begin by answering any questions that were submitted to us in advance of tonight's session. And we'll be moving into that space with our delightful Dina.
Thank you, Karine. Okay, so let's go with the questions that were submitted, pre-submitted for the region. There were two. The first question reads, what is the plan for a Chicago-based Birth to 5 Council? I'm glad you asked that question. And if you've been listening, you already know the answer. And so I should say this, Every Child Ready Chicago is the Chicago-based entity for this work. So we at Birth to 5 have aligned our efforts and our actions with them. Tomorrow, as mentioned earlier on this webinar, tomorrow at noon is the kickoff for Every Child Ready Chicago and Birth to 5. And also at 5:30 p.m. Yes, okay. Noon and 5:30 p.m. And once again, we will drop that link for you in the chat if you're interested in attending that webinar. The second question reads as follows. I am currently a part of the AOK network and would like to know how this is different and or how these two entities could work together in areas that already have an AOK. Okay, so we know that some AOKs are local and others are regional. And so for the regional AOKs, we've begun conversations with them already around alignment for outcomes. We are working to build on the great work that's already been done. So we don't want to try to dismantle any work that's already been done. We're just going to join efforts and continue to build from there. Was there anything that anyone wanted to add, Sonia, or to that response?
No, not really any more to add. You answered it beautifully.
Okay.
But just to kind of reiterate, AOKs that are already out there and doing this wonderful work and have been in regions we are looking to partner with. And like Dina said, we have started those conversations with those that are working at a more regional level. So covering that same geography that the action councils are and family councils are intending to cover. So we are figuring out like where we are similar and where we are different to make sure that there are no duplication of efforts. We know that funding in early childhood is very precious. And so we want to be responsible in making sure that we are not duplicating any efforts. And we're very committed to that, to making sure that we are utilizing dollars in a fiscally responsible way. So just wanted to add that on that, we have that on our radar and we have started to have those conversations for those that are regional, and then those that are local, of course, once we get our regional managers in place. Some of our area coordinators have already reached out and made contacts with the more local AOKs. And so we will just continue to build on that work.
Thank you, Sonia.
Yep.
Okay, so now we're going to bring up some of the standard frequently asked questions that come to us. What you should know is that we frequently receive questions about child development, early childhood educator compensation, child care assistance, data, and program funding. And those questions are really not within our purview. However, what you can do is go to the website, Illinois Cares for Kids. That link is being dropped in the chat right now. And you should be able to find your question around those issues that I just mentioned on the Illinois Cares for Kids website. And so with regard to some of the standard frequently asked questions, there are about 3 or 4 that I just wanted to quickly review with you. So the first one reads as follows: what are the deliverables of the Birth to 5 Action and Family Councils? In year 1, the councils will be working on connecting and reconnecting families to services as they were utilized pre-pandemic. So per the state's directives, Birth to 5 Action Councils will deliver a full regional scan, that's that needs assessment that we spoke of earlier, of the early childhood education and care service landscape by December of 2022. This report will be generated by our wonderful partners, Illinois Action for Children. The second question reads as follows: what is the state of Illinois already doing to encourage parents to take their young children to enroll in early childhood programs? So the state is currently running a statewide early childhood awareness and enrollment campaign that focuses on family and community engagement, strategies that promote the importance of early learning and the availability of early childhood programs and supports to families. That campaign will be launching very shortly within the next couple of weeks. As part of these efforts, Illinois Cares for Kids is inviting all families to join Ready for K. Hopefully you've already heard of that. It's a free research-based text messaging program for families with kids ages 0 to 11. Families can expect to receive 3 texts per week with fun facts and tips on ways to help their children learn and grow. Illinois families are encouraged to sign up now. That link is being dropped in the chat right now. So you can follow that link in the chat box to learn how to sign up. The third frequently asked question is as follows: what's the time frame to stand up these Birth to 5 Action Councils? In essence, when can we expect to see the implementation of this work? Well, Birth to 5 is providing a statewide infrastructure, staffing, and framework for communities at the regional level. The councils will be developed based on community interests. That's the overarching theme that you've been hearing all evening, folks. So it's not a state timeline, but it's based on community interest. So We will move to formalize the Action and Family Councils when the staffing positions have been filled and diverse community members are interested in being on the councils. So if you haven't already filled out an interest form for the Action Council, for the Family Council, or even for the regional manager position, we would strongly encourage you to do so. And then finally, why is the data on your website and shared during your February kickoff events outdated? The Illinois Early Childhood Asset Map, or ICAM, does not have early care and education data for the current year because ICAM receives this data from state agencies near the end of the following fiscal year. Likewise, ICAM pulls demographic data from the US Census, typically after end of the year releases. So between 1 and 2 years, depending on the geographic region, and after the target year. For example, demographic data for 2019 appeared around the end of 2020 and the beginning of 2021. Additionally, the US Census data release schedule has been affected by COVID-19. So this is why we need action councils to help give context and make sense of the data that is not able to be measured at a single point in time. So that concludes our frequently asked questions. And now we're going to go to live questions. If you have a live question, you can drop it in the Q&A box at the bottom of your screen, or you can use your raise hand function. And to guide us in our live action is our very own and magnificent Maggie.
Thank you so much, Dina. Thanks again, everyone, for being here. We do have numerous questions in the chat box or the Q&A box, so I'm going to just dive right in and start asking. All right, so first questions is, I know you do not have a deadline for when the interest forms will close, but how will you announce when the different regions begin to fill their councils? What kind of follow-up can people expect after filling out an interest form?
All right, that's a great question. I would like to pass that back to you, Maggie, since it's a communications question. I will start to answer that question. We will be announcing via like our social media and email and our newsletter. If you've subscribed to any of that, those communications will come out there. It'll most definitely be on our website as we begin to fill. But also before we close interest forms, we will give notice, that that maybe a few weeks, we will be closing them. So any final interest forms for those that are interested, there'll be an opportunity. So they won't just close. We will give notice before we close interest forms for a particular region once we get a nice diverse pool of folks that are interested. So that's my piece of the answer. And I will, Maggie, add on.
Perfect. Thank you, Sonia. So yeah, when the regional managers are hired, which is also going to happen kind of piecemeal, again, when really people have expressed interest and applied, and when we're able to fill those, we'll be communicating via email and our website. And once those positions are hired, we'll really be able to dive in and stand up those councils. And then additionally, we've done some targeted email communication to folks who have already filled out an interest form, just to say, we hope you stay engaged. Please be patient while we kind of roll this out, because again, it's going to look different in each region. And then for those who have completed an interest form for the Family Council, David and Dina, community engagement, staff and specialists from our team have done some targeted outreach and are planning to host some kind of like webinar and Zoom sessions to just, start to build community and communicate and answer questions for those folks that have them too. So we're trying to just make sure that everyone stays engaged. But as Sonia mentioned, we'll just be really utilizing our social and email and website to begin communicating around when the positions and then when those councils really start to get filled up. So fantastic question. Thank you. All right, next question. I live in the western suburbs. However, can I be part of the Chicago region?
So another great question. And so just a qualifier. So are you trying to be a part of the Chicago region on the Action or the Family Council, or are you interested in a position? So if you're interested in being on the Action or the Family Council, we say you can go where you live or where you work, wherever you feel like you'd have the biggest impact or have the most feedback, and where you feel most comfortable. If you are looking to apply for a position, you do have to live in the region that you are applying for. So I'm not sure if you're referring to the Action Council, the Action or Family Council, or if you are referring to being a part of the region as in staff for a particular region. So I just wanted to make that distinction there.
Action Council.
Okay. So yeah, we leave that decision. We leave that decision to folks to make that on their own, like based on their knowledge and where they feel like they could have the biggest impact. But you can go either where you live or where you work or receive services. You can apply for any region that is inclusive of those.
All right, great. Thank you, Sonia. So next question, how will families who choose to keep children home and not in childcare have access to support in developing and caring for their children? We have to make sure we're supporting families who choose not to use out-of-home care. So I'll just start really quickly and just say that the Ready for K text messaging platform that Dina mentioned that is available to all Illinois families is one of the state's strategies for reaching families who are outside of the system and outside of the services. So really just encourage use of that platform, which is totally free to families to be receiving those developmentally supportive tips. But I think too, building this local infrastructure is part of the way that we're hoping to really engage more families with respect of whether or not they choose to put their children in care. So happy to let anyone else follow up on that. I just wanted to flag that about the enrollment campaign.
Absolutely. And I just want to reiterate, we do respect family choice as far as care for their children. So we are respectful of that. As Maggie said, there's the Ready for K that is available. There are also programs out there that provide services in home. So you have home visiting services is one of those services where they come to your home to provide coaching and activities that you can do with your children in your home. So those are services that are available to you. Those services are available to you and are already out there in the communities.
And if I could also add to the conversation, that's one of the reasons as Area 1 coordinators that we're reaching out to all the community stakeholders, and so partnering with the libraries, because we know that those are also community resources that are available to families who are making those kinds of decisions to keep their children at home and to provide services outside of attending a community early child care program. So if you are aware and you want to have your library included as part of the conversations that are happening, these are the people who we're trying to reach out to as well. When we talk about community stakeholders, it's everyone that has a hand and the ability to support early child care education in the state of Illinois.
Yep. Thank you for that.
Thank you, Corinne. All right, we have a couple more questions. Sonia, this one's for you. How many seats have already been filled and how many have yet to be filled for the Action and Family Council in each of the regions?
So that is a great question. So as we said, we have put interest forms and everything out for all 39 councils. So we will go where the interest takes us. We are leading this and we will stand up councils, like we said earlier, where communities are interested. And as soon as you're ready, we're ready. I will note that we have not received a lot of interest for Region 56 specifically, which is Will County. We've received 4 interest forms submitted for the Action Council and 1 for the Family Council. So we really, really, really need your support and your help to get that word out in that region, so that we can get more interest forms submitted for those that would like to participate on either the Action or the Family Council. For Cook South, which is Region 1-B-C, we've received 13 interest forms for the Action Council and 1 for the Family Council. So again, we need to get a little bit more traction in Cook South and those cities that are south of City of Chicago, to garner more interest there so that we can stand up councils there. Another thing to note, we do have these 39 positions. We are in the process of screening and interviewing. Really, just like the Action and the Family Council interest forms, the interest with those positions has been really sporadic across the state. So, we don't have any region in the state that has like just a multitude of folks that have filled out the interest forms, or a multitude of people that have applied for positions. So we are doing our best to target outreach to those specific regions where we have really either not gotten any traction or very few interest forms or applications submitted for council. So we are beginning to start the more targeted outreach. So I know Dina has been reaching out, Dina and David have been reaching out to get more traction as far as where families are. So Dina, if you wanted to talk a little bit more about that, that'd be great.
Yes, thank you, Sonia. So when Sonia speaks to targeted outreach, my partner in crime for all of this family and community engagement work, as I said earlier, we will go where we're invited. And so as we dropped those links for the flyers that are available that speak specifically to the Family Council, if you want us to come and talk to your parent group, any parent group that you're connected with, we can certainly do that. We've been doing that all across the state, talking to like Illinois Head Start, for example, reaching out to those parent groups, going to community events to speak, to share flyers, and really, and even with speaking directly with parent groups, asking for their networks. So, just like each one reach one. And so we've been doing that. And if you have other parent-facing organizations or groups that you're connected with that you think we may have missed, you can share that information in a chat box, or share your contact information, and we can connect with you to have a discussion, so we can do even more outreach efforts. Thank you.
Thank you, Dina. All right, we have a few more questions. What happens if the interest remains low? What would happen in a certain area is the question, if there just really wasn't any traction.
Again, it gives us an opportunity to do more of that targeted outreach, and that's with those connections. So working very closely with our area coordinators that are our boots on the ground to do more of that targeted. Also with media and social, which includes social media, newspaper, that type of media as well, radio stations. So we're looking at everywhere we can get to families and get to folks to get the interest. That's what we're looking at, doing more of the targeted outreach to those specific areas. And so as we move along and we kind of see where we are and see what strategies are giving us the most bang for our buck, then we'll, kind of double down on those strategies to make sure that we're doing that across those regions that need more of that targeted focus.
And I was just going to add, like, if we have half of the amount for the Family Council, for example, like if we have 7 or 8 people, we can stand up, starting to stand up with 7 or 8 people, and then continue to build. Because again, if we have 7 to 8 people that have expressed interest and are going to make up that Family Council, then we're going to ask those 7 to 8 people, what are your connections? Who do you know? What parent-facing groups are you a part of? What's your network? Can we tap your social media? It's just about working together. It's about working together to make it happen.
And thank you for saying that, Dina, because that goes for the Family Council, it goes for the Action Council as well. We'll start with a smaller group. We don't necessarily have to wait till we get a group of 15 diverse folks. We may start with, like Dina said, 7 or 8 there, and then add on as we go. And so thank you for bringing that up, Dina. That's a great point.
All right, I know it's just 7:01. We have a couple more questions. I'm just going to zing through really quick and combine two that I think we can kind of answer. We know they're very active and awesome groups, not primarily early childhood, but heavily engaged, such as the Latino Policy Forum and the Logan Square Neighborhood Association. Is there a plan to interact with organizations such as these? And then one additional question, are local schools notified as well to make sure they're inviting their staff and families? So I'll say yes to all of this. Again, you know, we have this large scale kind of statewide, but community targeted kind of communication strategy. We have our area coordinators, boots on the ground. We're working with the Early Learning Council. We're working with our state partners, but it's awesome questions like these that are really helpful to us, because if there's a particular organization with whom we're not connecting, please feel free to contact us. Again, reach out to any one of us, or reach out to our info ad, or drop something in our contact box to say, hey, did you think of connecting with this group? And we're happy to just continue to make sure that we're, you know, connecting with those people in those organizations and they can help support the work. So absolutely.
With regard to the question about school districts, David Curis, who is our Family and Community Engagement Coordinator, that is his area of specialty, that's his background. So we are most definitely taking, using all of his knowledge and his skills and his expertise to reach out to those local school districts.
All right, and then the last question, any help from the media outlets to get the word out? So great question. When we did our February launch, we did a huge media push and didn't get very much traction because I still think we're relatively unknown. And so we're building our relationships with media over time and really trying to be strategic about what's going on in the field that we might be able to leverage. But so far, we just didn't really get picked up because we were brand new. You know, we only existed for a month. So we definitely have room to grow there to get some of the press involved in the work that we're doing. Thank you. All right, just seeing that we're a few minutes over, do we want to go ahead and wrap it up for this evening? I think we've answered all the questions that have been submitted. Mm-hmm.
All right, so if we can just bring up the last slide, thank you. Again, just wanted to reiterate, you know, next steps and how to get involved with us. Again, just pointing out that those interest forms are out there for the Action Council, the Family Council. If you don't, you know, can't make that time commitment but want to be involved, there's the selection committee that is available as well. Our website has a wealth of knowledge and a wealth of information on there. Our frequently asked questions, as Karine talked about earlier, is a living document that grows almost daily. And so if you think of questions after tonight, please check out our frequently asked questions. It has probably been asked and answered already. We've gotten a ton of questions that we've answered already. If not, again, Karine Nunnally, her information was dropped into the chat. You can follow up with her, or you can also send questions to our info at email address. And then the last slide. All right, well, thank you everyone for taking time out of your day to join us tonight and for sharing, you know, all of your thoughtful questions and feedback and insights. This was a wonderful conversation tonight with a lot of great thoughtful questions and feedback. For us, we always appreciate that feedback. We take it and we use it in our daily work. And so we look forward to working with you all really soon. Have a great night, everyone.